Hi, Sue. It's really great to have you with us this afternoon, this evening, actually here on the East Coast.
Hi, Susan. Great to be here, and hello to everybody.
Yeah, it's really, really great. I hope everybody has kind of woken up from our turkey coma here in the U.S. for Thanksgiving. But we thought we'd like to talk a little bit today about nurses and caregivers and some quality of life issues. And Sue, you and I were just recently in, oh, and I guess I should probably go back. I forgot to mention, I know, Sue, you have some disclosures you just want to put up on the screen. Perfect. Great. Thanks. Thanks, Mike, our wonderful production gentleman behind the scenes who's so good at making sure all this stuff flies really well. So Sue and I were both in London last month, and one of the really exciting components of the whole program in London was the first time ever that nurses from different countries got together. And I thought it would be really great to share with everybody a little bit about the Cutaneous Lymphoma International Nursing Network workshop that we hosted on Friday morning. And from my perspective, what is so exciting about it is this was really the first time nurses had connected and come together to share best practices, talk about caring for patients in cutaneous lymphoma. And we had a full morning workshop with nurses from the US and the UK. And I thought maybe you could talk a little bit and share with folks about what you found so interesting and exciting and why this is of particular importance and I think a milestone in cutaneous lymphoma.
Sure, Susan. I have to say that meeting, we'll call it CLIN for short, was the inaugural meeting of nurses from the US and internationally, primarily nurses from Britain, who felt it was important to get together and share these best practices, as Susan mentioned, in treating patients with cutaneous lymphomas. And as Susan said, we had two nurses from the US, one from Boston, one from Pittsburgh, and we presented case studies. And then another nurse presented from Great Britain, presented about transplantation. And then we had some a caregiver discussion. And we also had some breakout groups, talked about itching as a common problem, and nurse-led clinics, and also wound care. What I thought was really exciting was that we are more alike than we are different, that we share the same ideals and the same goals for our patients. We certainly were interested in the differences in how we practice, and I can get into that if you would like, Susan, but I really think it was the first great step in bringing together an international community with the same goals of improving patient care and establishing best practices on an international level, and it has never been done before.
Yeah. Thanks, Sue. And I think from my perspective, what's so wonderful is the fact that from here, after this inaugural meeting, we'll be able to take some of the outcomes and share those with nurses from around the world with the intention of connecting as many of the nurses who care for people with cutaneous lymphoma worldwide to share best practices, to share ideas, and to your point, to really make sure that everyone, no matter where they live in the world, gets good care. And I think, to me, this is just a great first step in making that happen. And it was a great experience. And then I also want to make sure, because this was my bad, at the top of our talk, I wanted to make sure that the audience posts their questions in the Facebook chat about caregiving or quality of life or anything along those lines that you want Sue to address. and we'll try to take your questions either as we go or at the end of our time together, and make sure we get everybody's questions answered. So post in the little chat box, and we'll monitor those and take them from there. So great, Sue. Well, thank you for that. And then the next thing, I thought we would move into the actual, last month, Dr. Kim talked a little bit about the scientific component of the International European meeting in cutaneous lymphomas, but there was also quality of life presentations at this meeting. And at least in my experience, this was the first time there was a quality of life component at a scientific meeting for cutaneous lymphoma. And also, you had the chance to present a really exciting study that you did to all of the physicians who were in attendance at the poster session. And there were some really other interesting quality of life presentations, as well as a patient and who has done some art projects who exhibited. So I don't know if you can share a little bit from your perspective, the quality of life presentations, and then maybe we can roll into a little bit about your caregiver study and what you presented.
Sure. Well, I think, yes, what hit me at that very scientific meeting was a huge focus on quality of life for patients and also caregivers. And I noticed in many of the studies that are being conducted right now or planned for the future, quality of life is one of the criteria that will be looked at in each and every study. And so this is probably an inroad or kind of a breakthrough that happened well over 10 years ago with the groundbreaking quality of life study that Marie-France Demir did. And since that time, there's been much more focus. One of the presentations I thought was very interesting was about the quality of life for bereaved caregivers. And it really, I believe, stunned the audience in that they learned what it is that caregivers are going through when patients are very ill, and for those patients who succumb to their disease, and just how much this impacts everyone's life. So that to me spoke volumes. I am more interested in, for my study at least, more interested in what is caregiver burden for patients with cutaneous lymphoma. I became interested in this since I have been at the bedside of patients for well over 30 years. I started out doing photopheresis therapy with patients and was one-on-one with them and their caregiver for at least 20 of those years. Now I've segued more into research studies, but I still am involved with caregivers and the burden that they carry. So I can go into more of that study if you'd like, Susan. But that is why I began to study it, because it was evident to me that there's something unique about caregiving for patients with cutaneous lymphoma.
So from your perspective, and I know you've been practicing in this arena for a very long time, do you have some perspectives? I know you did your own caregiver study. It was a little bit small, but are there some things that you learned in doing that study and in your years of treating and working with cutaneous lymphoma patients and their families that maybe most people don't think about related to caregivers, but that would be helpful for people to be a little more aware of, or to be more thoughtful about from a caregiving perspective?
I think for healthcare professionals, it's really important for them to realize that there's not just the patient in the room. The patient is sharing this experience with their family and especially their primary caregiver. And their needs also need to be addressed. Studies have shown that the strength of the caregiver can impact the health of the patient. So as supported as the caregiver can feel, that's how much more support they can give to the patient, which is ultimately what everybody is interested in. So that's one thing from the professional point of view, I think that we need to keep looking at and focusing on. And secondly, for the caregiver themselves, I think that they need to understand that this is something that affects them in a deep manner in both their personal life and their professional or whatever role they have in society and within their family. Everything's affected, and they can be unafraid to ask for support for that, to ask for help, to seek networking as the Lymphoma Foundation provides, and to feel free to discuss it with their loved one's physician and nurse about any issues that they might be having. I think it needs to be that partnership so that we can all address these issues.
Wow, that's great. That's great advice. And I know you had some insights from your study that we can share, right? You had some conclusions that you came to with regards to the data that you collected, this initial data on caregivers.
Right. So we, as you mentioned, it was a small study, 42 people, and we looked at caregivers, and we asked the caregivers to assess what stage or how severe their loved one's disease is. And we hypothesized that there are unique caregiver burdens for this group of patients and their loved ones. Specifically, scratching, itching behavior, shedding, other things, wound care, skin care has high demands. So we wanted to look at that in more detail. And we found that even though it was a small study, there were trends that indicated that those who have higher burden of disease, moderate disease or severe disease, as assessed by their loved one, by the caregiver, we found that they had higher scores, higher burden scores, higher impact on their quality of life, and that professionals, need to be aware of that, address those issues when they see the patient in the office. So it did correlate with higher burden correlated with more symptoms that the patient experienced.
Right, which would make sense to a lot of degrees, right? With regards to if someone has more problematic disease, it's a little more challenging to care for. Skin issues are more of a challenge. Quality of life is more of a challenge, and I would assume also that the impact on the caregiver themselves, as far as how they feel with regards to fear for their loved one or concern, would also correlate with the disease stage, I guess, of the patient, right?
One would intuitively think that. Our study didn't show that particularly, that caregivers were not admitting to feeling fear. At least we didn't see any trends that way. But I know that I think that's why we need to replicate the study, make it bigger, stratify it according to stages, and see what is affecting caregivers, even at early stages. There may be more fear and anxiety than we realize, and certainly for those with later stages. So we would like to replicate the study, increase the size of and stratify each by stage to see if we can tease out more of the quality of life issues, more of the burden experienced by caregivers.
Yeah, and I think that's definitely a project I hope that we can collaborate on and work together on and engage everybody who's joining us on the Facebook on this interview, as well as for anyone that listens after the fact, because the more that we can learn, the better we can develop care and protocols and things of that nature and really understand the impact. And I'll also then want to invite everybody who's listening and who's with us live to type in your questions and let us know what kind of things you'd like us to chat about with regards to caregiving and things of that nature. And I thought maybe at this point, Mike is our producer behind the scenes, but he's also a caregiver for his mom. And I thought it might be a great opportunity to bring him in to share a little bit from his perspective.
Hi, Susan.
How the disease has impacted his life. And
hi, Susan and Sue. It's so great to be here with both of you. And first of all, thank you both for doing this. I started the Sézary syndrome group as a caregiver because, my mom, when she was diagnosed with stage 4 cutaneous T-cell lymphoma with Sézary syndrome, it was an overwhelming experience, and the Cutaneous Lymphoma Foundation's website had so much great information, but at the same time, I wanted, as a caregiver, as much granular level detail as I could get about things like clinical trials and side effects, and whether gabapentin, for example, might work to help alleviate the skin pain and the itching that my mom had. And I found that through some research, and and that was the kind of stuff that I said, well, let's try to share it with other patients. Susan, I guess I would ask you from your perspective, and maybe Sue as well, in what ways can a caregiver really help to improve the outcome of the patient? I mean, is it possible? Because I think in my case, I asked my mom's doctor about a clinical trial, and as a result, my mom got into that clinical trial. It happened to be for mogamulizumab, and my mom's been in a complete remission for 20 months. And she went on romidepsin after the clinical trial, but the treatment really made a huge difference. So I'd just love to get your thoughts on some ways that caregivers can really make a difference in the treatment of their loved one.
yeah, sure. And Mike, I think that's a really great question to ask, and I'll share my perspective, and then I'll let Sue do the same. I think one of the biggest things is having good communication between caregiver and patient, but I think the better that you can be as open and honest about what's happening for you as the patient. I know for me as well, speaking from the patient's perspective, as I was going through the disease, I wanted to not burden my loved ones about what was going on, and I tried to do as much on my own. What I also then learned was that everybody who loved me really wanted to help me, and I didn't let them. So we got to a point where we kind of had a family meeting, and we're able to openly share. They wanted to help. I needed their help, but I didn't know how to ask. And, so we were able to really get that all on the table, which then allowed for better communication and really made a difference in me not feeling that I had to do this all by myself. And then also, of course, back in the 90s, there wasn't as much information, and the internet wasn't so robust, and the foundation really was just getting off its feet. So there wasn't a lot available, but I think good communication is really important. And for those of us who are patients, I think we have to be more open in sharing our real feelings so that those that love us can actually help. I don't know, Sue, if you have some other perspectives and ideas.
Sure. I really feel that the caregiver in many situations has an integral and very important role. Now, it does depend on relationships and whether or not the patient is capable or like you able to stand up for yourself and research things, or someone in the older generation who doesn't use the internet maybe needs more help. But however the caregiver fits into that scenario and can, over and above all, be an advocate for the patient and be what it is, a bit of a burden on the patient to let someone in and express what it is they need. And, communicating with their caregiver how much of an advocate they want them to be, how much do they want them to have. And I think it's, I've seen all ranges from very passive caregivers and passive patients to very assertive on both sides and a mix in between. But it is, like in Mike's situation, someone who can ask the right questions. Sometimes I try to be that role for patients when they don't have a caregiver who's doing that, or if the patient's not doing it themselves, helping them ask the right questions and getting the information they need. It's beyond critical for the success of treating this disease.
I found it to be very empowering for me to, the more research I could do, some of the articles were a little hard to understand, but the abstracts and, the Cutaneous Lymphoma Foundation now, with its Sézary syndrome news and insights page on Facebook and its mycosis fungoides news and insights page on Facebook, the foundation is sharing so many great articles and updates, Susan, as you know, to help patients and caregivers to become more knowledgeable, more empowered, and to make a difference.
Yeah, and I think sometimes information can be overwhelming, so you also have to take it in the chunks that you as an individual, whether you're a patient or a caregiver, can actually assimilate. I talk with a lot of newly diagnosed folks. Sometimes they're the patient, sometimes they're a family member or a caregiver, and it can be very overwhelming when you get an initial diagnosis, and it can be very frightening. And sometimes all of this information kind of is hard to wrap your head around. And I always share with people to take their time and to take it in the chunks that they can really understand and assimilate for themselves, kind of digest it, because I think then it makes it a little easier to figure out what questions you're most interested in getting answered, or where you are in your particular journey. And I think when you can have that kind of dialogue with your family and caregiver, it helps everyone to kind of wrap their head around what's happening and where the patient is in their particular circumstances, and to best be able to figure out, what should our game plan be when we go talk to the physician or our healthcare providers? What kinds of questions do we have? What do we really need to know at this point in time? Because it does take a while, I think, to kind of get your head around cutaneous lymphoma, because it's very different from pretty much any other cancer diagnosis out there. Sue, you have any other thoughts?
Just that, caregivers have different strengths and weaknesses, and you carry the burden differently among people. I had shared with Mike that I was a caregiver when my father was gravely ill, and being in the healthcare field, I also carried the burden of the success of his treatment squarely on my shoulders. And I would caution against that. It was almost an unbearable burden. But whether direct or indirect, my family placed it on me. They looked to me for all the answers. They looked to me for the explanation. So I think if you find yourself in that situation as a caregiver, be aware of it, have some strategies to help deal with that kind of pressure, because it's very real. And you do tend to take on the treatments, the other burdens that your loved one's feeling. So just be aware and ask for help.
Yeah, and I would thank Sue, and I would also say, we are also available for anyone that feels that they just want to reach out and have a conversation. Please always feel free to give us a call or drop us an email, because we're always happy to talk with folks, and maybe lend a little bit of a knowledgeable ear and a listening for anybody that needs it. And so I'll go to a question that we had posted, but it has nothing to do with caregiving or quality of life. But Pat asked, how often does CTCL convert to Caesary? And I don't know if you can answer that question, Sue, but if you have any thoughts on that.
To be honest, I don't have the statistics for that. I would just say that it's not common for garden variety or standard early stage mycosis fungoides to transform into Caesary. It doesn't happen that often. It can happen, yes, but it's rare.
Right. And Caesary just, oh, sorry, Mike, you were going to say something? No, go ahead. I was just going to, sorry. I know, I was just going to say, Caesary tends to be more impacted in the blood versus in the skin, even though there's a skin component. So almost, we still don't have definitive answers from the scientific perspective yet, as far as I can tell, and depending upon who you talk to, it's a little different disease, same T cells, but a little bit different iteration on the theme.
Yeah, one additional question that I kind of had, Susan, was whether patients ought to try to, and caregivers ought to try to become aware of clinical trial options and other treatment options, just so that when they're in meeting with their doctor, they're using that 15 or 20 minutes or 30 minutes, whatever it might be, as wisely as possible to have a dialogue, to be engaged. I know every time I go with my mom to meet with her doctor, I have a list of questions about other treatments. And I just ask her, what are the pros and cons of each of these treatments? What are the side effects? How many patients have you been treating with this particular treatment? Have any of your patients gone on this clinical trial? What do you think about that? It seems to me, the more knowledge I get, the more empowered I feel. And I think my mom would say the same thing.
No, I think you and your mom are a great example of a good team approach. And I think that the more people know and understand and asking questions about clinical trials or the treatment options, what are the side effects, and it's not just about the physical side effects. We have a lot of options for treatment, and depending upon where folks are in their disease journey, topicals or systemic, but there are, even with topical treatments, if you're talking about light, for example, for early stage, but if you have to travel, an hour or two a day to get to an office that has a light box, that could be a bigger challenge than if there's another treatment option. So I think, to your point, understanding what all of the options are, being able to have that kind of discussion with your physician that take into consideration the whole of the person's situation, not just the disease, but let's look at lifestyle. Are they working? Is it hard to get off of work? Can you fit a treatment into your lifestyle? Where are you going to get the best bang for your buck for, all intents and purposes, right? For different kinds of treatments. So I think the more knowledgeable you are, the better prepared you are to make the right and best choice that's available at any given point in time.
Right. I absolutely agree. Mike, you're at the top of the line for going in and being the best advocate you can be. Patients can do that. Caregivers can do that. It's really, I can't overemphasize how important that is. It's difficult. It takes a little bit of time, but it really is well worth it to go in armed with the right questions and the right knowledge for what disease stage you are and what, as Susan mentioned, what treatment challenges you might be facing, and be honest with the physician about what will work for you and what not, and how you can work around those challenges. If that's the treatment you need, how can you work around those?
Yeah, and probably a topic which we won't have time for today, but maybe something in the future is, once you've decided on the right treatment, then how do you make sure that you can, your insurance can pay for it and you can get access to it, and what other kinds of resources are available, and how can you best leverage your healthcare team within the facility and take advantage of resources that I think sometimes a lot of people don't realize they exist. So, the nurses and potentially social workers and things like that, where folks can get some additional support to make sure that they can access the right treatment for them at that given point in time.
Yeah, and I just had one more question. I know we're running long on time, but just Sue McCann, as a nurse specialist, do you have a sense of when it's appropriate for a caregiver or a patient to call the doctor or the hospital when they're not sure if the side effect they're having is appropriate to call or not to call? Do you have any thoughts on that?
I think that it is, anytime you're worried that something has changed, something is different from the baseline, and it is worrying you, whether that be an abrupt change in the skin condition or vital sign change, patient is feeling dizzy, or their heart rate's going fast, or it's dropping low, or they have other complaints that are really out of the norm, or they are very uncomfortable, can't sleep, it's affecting quality of life severely. It's okay. We want you to communicate with us and call. So, I'm not saying call anytime there's, you have a splinter, but it has to be in perspective with what's out of the norm. You just started a new treatment and things are changing. Maybe you just need reassurance, and that's okay too. So I encourage people, call. If you're not dealing with an academic or university setting, ask your doctor's office, what should I do if I have a question and it's the weekend? Who can I call? Just be upfront and say, I'm afraid, I might need help. What should I do?
That's great. That's great counsel. I don't think I would have ever thought to even ask that question. So that's one that goes in your question to ask book. Mm-hmm. For sure. And actually, and that's also something that I recommend to folks too, is to keep a journal or just a notebook, so that as you think of these kinds of things or something comes across, it triggers, you're watching television and an ad comes on and it triggers a question, just write it down so that you have it available the next time you go in to see your physician or your clinical team, so that you to Mike's point, you've kind of got your ducks lined up, so you know what kinds of questions you want to ask and make sure you get them answered while you're there. But this is a good one to put on the list, for sure. All right. So, Mike, do we have any other questions?
Yeah, I think we're set. Maybe we can thank Sue, and then also maybe you can just, before we go, give a quick heads up about that announcement that came out today. Susan, do you want to do that?
Well, first I'll thank Sue for joining us and for taking the time and energy. As what you probably don't see is all the prep that goes on behind the scenes to make this look effortless and easy. And Sue and Mike did a lot of prep work to get us to this point and to be able to do this cool double picture thing. So hopefully this is a good format for everybody. And Sue, really appreciate your time and energy, and we're excited about the possibility of expanding your caregiver study and seeing how we can collaborate and coordinate to get a broader perspective and to gather that data down the road, because with data then we can really do something with it. So thank you for your years of time and energy, and we'll see you soon.
I'm so happy to be invited and happy to participate. Thank you very much.
It's a pleasure. Have a great holiday season if I don't catch up with you before the end of the year. So
you too.
Take care. All right.
And you want to just give us that was really interesting news today.
Yes, so we have an exciting new project. I'm going to try to hold it up here. I don't know if anybody, you probably can't really see it. Let's see. It's called the Itch Tracker. And it's a pilot project that is, you have to have an Apple Watch first. But if you have an Apple Watch and you are a cutaneous lymphoma patient and you would like to participate, the app that's been developed is to capture itch while you sleep, to capture data so that we can begin to understand across all different kinds of skin diseases and other diseases that have itch as a component. So it's not just cutaneous lymphoma. And to be honest, we're a little late in the game in the project, but we have the opportunity for anyone who is interested that has an Apple Watch and you want to join us, email me personally. It's susan@clfoundation.org, and we'll put you on the list. And as soon as I get the information on how to participate, probably a little later this week, I'll send that out to everyone who has an Apple Watch and is interested, and we can get cutaneous lymphoma data into the study, which hopefully this will then allow us at some point down the road to potentially work with the company that's put this all together to maybe create an app specifically for cutaneous lymphoma patients. So if you participate now, you could be helping us to expand this in the future. So if you're interested, give me an email and we'll get our folks engaged and then see where it takes us from there.
And I know it's a very short time frame, so we need a handful more of cutaneous T-cell lymphoma patient or cutaneous lymphoma patients. So whether you have mycosis fungoides or Sézary syndrome or some other form of cutaneous lymphoma, if you send Susan an email, it's got to be quickly because the recruitment phase is closing quickly here. And we need enough cutaneous lymphoma patients in order for us to be a part of it. Right, Susan? Right.
Yeah, not many, but we've got a few folks interested already. And so if you're interested, give us a call and hopefully we'll see where we go from here. But exciting way to use technology down the road for all of our benefits.
And one last thing, Susan, next month we're going to be back in December with another guest. And
yes, we're going to have Dr. Pierluigi Porcu joining us. He is head of the hematologic malignancy program at Thomas Jefferson University here in Philadelphia. And we're all headed off to the annual hematology annual meeting next week, which is being held in Atlanta. So he'll be providing us with some highlights from that scientific meeting with regards to what was presented in cutaneous lymphoma and highlights from that meeting next week.
So there might even be like some results from some clinical trials possibly?
We hope so. I believe there will be some presentations from the mogamulizumab team who have been crunching data now for the last year in preparing to present their final data to the FDA for approval. So whatever, this scientific meeting in December is usually a big meeting in hematology for that. So this is a big deal. And I'm pretty sure the brentuximab vedotin folks will be presenting some data as well from the Alcanza trial. And as everybody probably saw, or if you didn't, brentuximab vedotin got labeling approval from the FDA just recently, a couple weeks ago, for cutaneous lymphoma. So that's a big deal. And hopefully in the next several months, we'll have mogamulizumab on the books as well. But too soon to tell. We don't know yet.
Sure.
So still has to go through FDA.
Well, it'll be a great, another live Facebook chat. So mark your calendars now. This will be in the evening on the East Coast around 7 p.m. on Friday, December the 15th. So mark your calendar and be sure to join us again. Thank you again, Susan and Sue. And I guess have a great night.
And you, Mike, thanks so much. And it's really a pleasure and an honor to be able to kind of come to everyone live in this format. And we look forward to next month. So everybody have a great couple weeks.
Bye now.
See you soon.
Good night.
Good night.